So, good morning, everyone. So, we are continuing with the topic design or basic principles in designing a removable partial denture for different types of partially edentulous arches. So, last class I was talking about what are the factors we need to consider for a particular type of major connector or a particular type of minor connector or a direct retainer, or how many indirect retainers has to be used for particular conditions. So this is in continuation with the same topic. So here we are seeing a condition where we have a class 3 situation. A class 3 situation, as you all know, there is a single edentulous space with anterior and posterior teeth uh, present around that edentulous space. So this is a condition where we have one single edentulous space present between anterior and posterior teeth. So here we are seeing these are the two primary supporting abutment teeth, wherein we have a premolar on the anterior segment and we are having a molar in the posterior segment. So that's why a line has been drawn between two primary supports. So this is the area, or these are the teeth which support the removable partial denture. So next, so this diagram represents an unmodified area in the sense, or unmodified class 3 in the sense we don't have any other modification spaces. So these are the primary supports, support 1 and support 2. So GP is nothing but guided supports, or guide plane 1 and guide plane 2. So what basically that means, these green lines represents a component of removable partial denture which is known as a guide plane. So they help in guiding the removable partial denture between the abutment teeth. And as I was telling you, these are the primary abutments. Primary abutments in the sense, these are the abutment teeth which bear the load completely, or which bears the load of a removable partial denture, or these are the teeth wherein we place our rest seats through which a load is being distributed to adjacent hard and soft tissue both. Being a class 3, there is no load which is given to the soft tissue here. All the load is borne by hard tissue, that is teeth on either side of the arch. So here you can see the load is being distributed uniformly between anterior and posterior teeth. So the same thing. So these blue things are nothing but the rest seats. By placing a rest into a rest seat helps in distributing the load onto that particular structure. So whenever a removable partial denture is inserted into the patient's mouth, the rests of the removable partial denture, they go in and seat into the space provided. So rest seat is nothing but we are preparing a seat for receiving a rest. So that's called as a rest seat. So these rest seats are prepared into the occlusal surface of the premolar and molar on either side. Into that rest seat, the rest of the removable partial denture will go and be seated. So once that happens, these are the two terms what you need to understand, a pivot and a fulcrum. So what exactly one rest and two rests? See, you can see a line. This is an imaginary line. The red line is an imaginary line which joins the principal rest around which, so the blue mark, you can see the direction of the arrow around which the rotation of the removable partial denture happens. So a fulcrum is nothing but an imaginary line which connects two rests, two principal rests around which the rotation of the removable partial denture happens. So what we need to understand is we need to reduce the amount of rotation by uh, designing a removable partial denture by incorporation principles of engineering principles into designing the removable partial denture. So whenever this rotation is there, that will be harmful for the supporting structures. So we have to restrict this moment as low, or we have to keep this rotation as low as possible, so these harmful effects are not given to the supporting structures. So a fulcrum is nothing but an imaginary line which runs through two principal rests or principal abutment teeth. So how we are going to restrict the amount of movement? By adding, or by cross arch stabilization. That means we are connecting the removable partial denture components from one side of the arch to the other side of the arch. In doing so, we are getting a cross arch stabilization. And how we are getting that cross arch stabilization is by adding components uh, from one side to the other side, and both the components are being connected with the help of a major connector in between. So we are fabricating a removable partial denture with components on either side of the arch which are connected with the help of major connector. That helps in reducing the amount of rotation around the fulcrum line. So now getting back to that design, principal abutments, guide planes which guides the removable partial denture between the abutment teeth, the rests where for the primary abutments, and to reduce the rotation we are, so this is the fulcrum line, that red line. So we are drawing a perpendicular bisector to this imaginary line. So you can see that dotted line there. So that location on the opposite side of the arch will be an ideal location for our components that can be either indirect retainers or direct retainers. So we are preparing receipts on the other side, and this is a design for placement of receipts on the opposite side of the arch. So last class I was talking about quadrilateral configuration, tripod configuration, and bilateral configuration of direct retainers. So here you can see that tripod configuration. So to make the processes more stable and to uh, distribute the load over a wide area, or to distribute the load to not a single structure but to different structures or to more number of structures, we are drawing a design of removable partial denture in such a way where we have cross arch stabilization. That means we have receipts on the side where we are missing the tooth, and we have receipts on the opposite side of the arch where there are complete set of dentulous units or complete set of teeth. So by fabricating a removable partial denture with four receipts from one side of the arch to the other side of the arch, we are getting more number of supports. We are getting basically from 2 pillars to 4 pillars. That means 2 receipts to 4 receipts. So in that way, we are adding more number of components to the other side of the arch, and we are getting or deriving support from both sides of the arch. So this is the line that will be the ideal location from the fulcrum line. If the edentulous span is small, then we can go for this tripodal configuration. If the edentulous span is long, then we can always go in for a quadrilateral configuration. That means we are uh, creating some distance between the additional receipts, so that the area which is occupied, it will be more, so it will be advantageous in distributing the load over a wider area. So depending upon the number of teeth that has to be replaced, we have to change our design also of the removable partial denture. So in the next uh, pictures we can see here. See, here only 2 teeth are missing, one premolar and one molar. So that's why we are placing our support units on the contralateral side of the arch, very near. That means the distance between the receipts, we are zeroing it out. And the major connector we are giving is a palatal strap type major connector. But in the same sense, that means in same like a class 3 situation, if the number of teeth are being lost are being more, or number of teeth being replaced are more, that means the edentulous space has increased. So for that type of design, the distance between the rests are being increased. One rest we are placing on the molar on the contralateral side, and the other rest we are getting it to more anterior section. That means we are increasing the area, and we are changing the design of the major connector by making it an anteroposterior palatal strap. So here we have a quadrilateral configuration. That means here it is a tripod configuration, but in the next case we have quadrilateral configuration. So the load will be applied over a wider area. So that's how we change or keep changing our design of the removable partial denture depending upon the condition, depending upon the number of teeth that are being replaced, depending upon the position of the teeth, depending upon the condition of the teeth, whether they are weak, or if they have periodontally compromised teeth at either end, depending upon the configuration of the edentulous arch, the consistency of the tissues, height of the alar bone, the width of the alar bone, and any other anatomical anomalies. If we are having a tori, so we are giving a window. This is a closed horseshoe major connector what we have given here. So depending upon the condition of that particular partially edentulous arch, we keep changing our design. So this is for class 3. In the same way, when we are designing a removable partial denture for a class 1 situation or a class 2 situation. We have a completely different scenario here. That means we have a soft tissue at one end and we have a hard tissue at the other end. That means we have two different supporting structures with different compressibilities. That means when a load is applied, the amount of tooth that moves in the socket and the compressibility of soft tissue, these two things they vary. So we have only 100 microns movement vertically in the socket once a load is applied onto the tooth vertically. If at all, if we compress the soft tissue can move up to 2 millimeters also depending upon the situation over there. So because of this variation, there might be more amount of rotation or movement in the removable partial denture during function. That means when you clench, the removable partial denture can move more towards the soft tissue rather than moving on the dentulous side. So because of difference in this compressibility, there will be more amount of harmful forces that will be given to the hard tissues anteriorly. So there is all the chance of removable part. There will be all the chance of abutment teeth loosening, abutment teeth movement away from towards the edentulous space, and there will be harmful forces given to the or tipping forces given to the abutment teeth right next to the edentulous space. So these things have to be compensated by understanding the condition of the removable partially edentulous arches. That means which type of partially edentulous arches when we are treating. So for class 2 and class 1 situations, we need to understand one principle, that is lever principles. These are levers are nothing but simple machines which come into existence during replacement of partially edentulous arches in class 1 and class 2 stages. So first we need to understand what are these levers. So a lever is nothing but a simple machine where we have these components in it. We have a fulcrum, we have a resistance, we have effort. So in this picture, we can appreciate it more. I mean, these are the day-to-day activities wherein we can see the function of these levers. It's where they come into existence. So this is a picture. When you look at it, you'll understand what exactly I'm talking about. So a fulcrum is nothing but a support around which the movement occurs. So the point where the movement is occurring, that is called as pivoting point or a fulcrum point. Then we have resistance. Resistance is nothing but the load that has to be moved is resistance. The effort is the amount of force we are applying to move the resistance. So a lever is, the complete picture of lever is this one. We have resistance at one end, we have effort at one end, and we have fulcrum in between. That means when we are talking about, or when you are talking in the sense of removable partial denture, if at all, if you are having a condition in where we have teeth at one corner, we have the load that is being applied at the opposite end, and the other thing is the food is getting crushed in between. So the resistance is nothing but the food, the amount of load we are applying to crush the resistance, and where exactly the movement is happening is at the distal most tooth. So that is the most dangerous position of or that is the most uh, action is happening at the distal most tooth. So we have to take care of that distal tooth by creating a fine balance between the resistance and effort. So how we are going to manage is we need to add an indirect retainer. That means we have to add extra support so that we prevent the movement of removable partial denture more towards the soft tissue. So for class 2 and class 1 conditions, we have to add an extra component in the design other than direct retainers, that is our indirect retainer. So for a class 2 condition we need to have two extra supports, and for a class 2 situation we have one extra support, that means one indirect retainer. So for class 1 condition we have two indirect retainers, and for class 2 condition we have one indirect retainer. So how many types of these levers are there? So we have totally three different types of levers. So this is the same picture. The blue point is being the pivot point around which the movement occurs. So the red one is resistance, that is the weight that needs to be moved, and here the green one is the effort, that load being applied to move the resistance, the red mark, the other side. So we have totally three different types of levers: class 1 lever, class 2 lever, and class 3 lever. So what is the difference between class 1, class 2 and class 3 lever? First, coming to class 1 lever. Class 1 lever is nothing but we have resistance at one end, effort at the opposite end, with the fulcrum, that is a support or the pivot point around which the movement is happening, it comes in the middle. For a class 2 lever we have resistance in the middle, the fulcrum or pivot will be at one corner and the effort at the other corner. So this is the kind of lever we come across for class 1 and class 2 situations. That is, the pivot point will be the distal most abutment, the resistance comes in the middle. The resistance is nothing but the food or the uh, dietary things what we take, so that has to be crushed, that comes in the middle, and we have effort at the, that is the load being applied to crush the food being at one end. So this is the condition which is harmful for the abutment teeth. And class 3 lever, we have resistance at the opposite end, effort comes in the middle here, and fulcrum at one corner. So class 1 and class 3 levers we don't come across intraorally. So what we come across is a class 2 lever. So how we're going to rectify this class 3 lever condition is by adding an extra support or extra pivot point away from the fulcrum, primary abutment. So that's how we are adding indirect retainer to this condition and improving the or increasing the support, and we are shifting the fulcrum away from the pivot from the distal most abutment to the anterior abutment. So the first lever to for your understanding this is how exactly these things happen. So class 1 lever is with fulcrum and in between resistance and effort, that is a class 1 lever. So that we can see here, these are the simple examples. A person is lifting a load with a crossbar. So the effort is being applied with the help of the hands. The fulcrum is below. That means the support he is getting from the earth, and the load that is being applied to move the boulder. So the resistance is the boulder, the effort is the amount of load applied by the person, and the fulcrum point or the pivot point or the support point is the ground. So in this picture you can see here the hand is the effort, the resistance is the boulder, and the fulcrum point or pivot point is the earth over there. So by placing a crossbar below the boulder on top of the earth, with the help of effort coming from the hand, we are lifting or moving the boulder away from its position. So in the same mechanism, if you have to remove a nail, the handle of the crossbar or a crowbar, or the amount of effort what we are applying at one corner, and fulcrum point is at the round end of the crowbar, and the V end is placed on either side of the nail head, and it is being pulled out. So the fulcrum, by placing it on the ground, the round end of the crowbar, we are getting support from there, and the resistance is by applying the resistance is pulling of the nail out of the wood, and the effort is the amount of load what we are applying to take out the nail from the nail bed. And a seesaw, this I think you all know, this is a classic example for a class 1 lever. We can see this condition in all parks and amusement, these things where kids they play with each other. So here this is a classic example for class 1 lever. And this is one more example how a head moves backward and forward around the atlas vertebrae, vertebra. That's the vertebra, cervical vertebra, around which the head tips or moves front and back and sideways. So that is atlas vertebra is a pivoting point or a fulcrum point, and the head, the chin portion moves down, and the head moves back, chin goes up. So that is a class 1 lever example. And rowing a boat, the water is being moved so that the boat moves forward. So how the water is made to move is with the help of the paddles. So you have the load applied at the paddles, the resistance is a water, and the moment at the fulcrum point which moves is a boat. The class 2 lever, this is what we are come across in a class 1 and class 2 partially edentulous arches. So we have support at one end, that is a fulcrum point or the teeth in the anterior section. Posteriorly we don't have any teeth over here. So this is a condition we have to be very careful, so that there should not be any harmful effects or harmful movements or tipping movements that should not be given more to the distal abutment teeth. So how we are going to rectify is by adding an extra support in giving an indirect retainer for this condition. So this is a classic example wherein we have a door with hinge. So when you open a door or close a door, door always rotates around those hinges. So we have fulcrum or moment at one corner, then we have the weight of the door and the load what we apply to move the door. Weight of the door is a resistance. The second one, a bottle crown opener. How to when you open a crown, what exactly the mechanism happens over there. So we have the resistance is nothing but the amount of the resistance is nothing but the crown on top of a bottle. So effort or the load applied by the hand to take out the crown, and the fulcrum is the bottle itself, bottle neck itself. So pushing a wheel cart. So this is one more example for class 2 lever. So you have effort near the hands, you have fulcrum at the tire, and the resistance is the amount of load that is being lifted by the worker. So class 3 lever is the same thing. The position of the fulcrum, it won't change, but resistance comes at one corner and the effort comes in the middle. So when you do exercise, this is how a person builds up his muscles. You have the load that is being lifted in your arm, the effect or the resistance is seen in the biceps muscle. Effort is seen in the biceps muscle. So the load is the resistance here, and the fulcrum point is the elbow. So these are the different types of levers we come across in our day-to-day life. So this is just for your understanding. So this is how we change the design principles according to different conditions of partially edentulous arches. So with this, we come to end of our topic, uh, that is designing of principles of designing of removable partial dentures. So depending upon the condition of the teeth, depending upon the condition of alar ridges, depending upon the position of the teeth, depending upon the orientation of the occlusal planes, and number of teeth being replaced, and different anatomical considerations, we keep changing our design of removed partial denture and see to that the load is being applied over a wider area. So uh, instead of giving load to only a particular hard tissue or a particular soft tissue, we can divide the load over a wider area so that the hard and soft tissues receive the load equally, and the life of these hard and soft tissues will be longer. So we have to keep in mind all these things whenever we are designing our removable partial dentures. Thank you.